Today we are discussing narrow therapeutic drugs, the ones you should never ever split or crush. But how are you supposed to know which ones they are? You aren't a pharmacist, and the bottle doesn't always come with a big warning label. In the pharmacy, we call these narrow therapeutic index drugs, but I want you to think of them as medications on a tightrope. If the dose is a tiny bit too low, it's like not taking it at all. If it's a tiny bit too high, it becomes toxic. There is no middle ground. I'm David, the lead pharmacist at MyRxPro, and here are the 5 ways you can identify if your parent is on one of these narrow therapeutic drugs. This is the biggest giveaway. Does your parent have to go in every few weeks or months for lab work specifically to check their levels? Drugs like Warfarin for blood thinning, Digoxin for the heart, Valproic acid for seizures, or Lithium for mood require constant blood monitoring. If the doctor is checking the blood weekly or a few weeks apart to see how much medicine is there, you are dealing with a tightrope med. Does your doctor or pharmacist insist on giving you the exact same brand every single month? Does the prescription say, brand medically necessary? Usually we swap generics all the time and even required by your insurance. But for narrow therapeutic drugs, like certain thyroid medications or seizure drugs, even the tiny difference between 2 different generic manufacturers can be enough to throw your parent off balance. If the pharmacy or doctor is picky about the brand, that's a red flag for a narrow therapeutic drug. Look at the prescription history. Does the doctor change the dose by tiny increments? Maybe they went from 88 micrograms to 100 micrograms. When the micro adjustments matter that much, it's because the window for safety is incredibly small. A split pill that isn't perfectly even may ruin that precision instantly. For most meds, a side effect is an annoyance. For tightrope meds, a side effect is a crisis. If your parent is on a blood thinner and they have a nosebleed that won't stop, or if they are on a heart med like Digoxin and they suddenly see yellow halos around lights, that is a sign the drug has crossed the line from helpful to toxic. Sometimes it's hidden in plain sight. Check the paperwork that comes with the prescription. If you see the letters NTI, that stands for Narrow Therapeutic Index. If you see that, it means handle with extreme care, no splitting, no crushing, and no skipping doses. When your parent is on a narrow therapeutic drug, the margin for error is 0. You can't afford to guess. If you're looking at a pill and wondering, can I split this to make it easier for mom to swallow? Stop. Go to my website and check my helpful articles on many narrow therapeutic drugs. And if you're still not 100% sure, book an urgent strategy call with me. We can spend 15 minutes looking at that specific medication together to see if it's a tightrope med and find a safer way to get them the dose they need. It's risk-free. If I can't give you an actionable plan, you don't pay. If you found this information helpful, please hit the notification bell, and subscribe to the channel to see the latest video. MyRxPro. Affordable care starts here. Let's keep them safe, one pill at a time.